For those who've had COVID-19, recovery can be a slow journey, even after you're feeling better and spending days or weeks in isolation. You may be eager to see family again or even step foot out into the outer world. But how can you tell if you've recovered enough to return to normal activities? Touro Family Medicine Physician Dr. Meredith Maxwell joins us to explain the latest CDC recommendations. Good morning, Doc.
Good morning.
So this is a change that lengthens by what, 3 days, the amount of time of isolation for someone who's recovering?
It is. It went from 7 days since your symptoms first started to 10 days since your symptoms first started. So people are that's kind of a downer for some people, but it is much safer. So the CDC is learning many things as this virus goes on and as we're learning more about it. And they're having trouble replicating or growing it at 9 days, and so 10 days it's been extended to.
You know, I think that's such a good point, and let's stop for just a second before we go on and remind everybody again and ourselves that I know you're aware of this, that this was a novel or a new coronavirus. And we really, you know, the assumption is a second wave is coming. The assumption is that if you get a vaccine, it will work, that sort of thing. But we really don't know a lot about this particular new virus, do we?
That's right, and things can change every day with this. So the more information, the longer we study it and research it, I think these guidelines will continue to evolve. And this is a good thing because we know more about it. We know how to be more safe.
All right, so back to the CDC standard now, this 10 days instead of 7. Essentially what they're saying is that the virus does not spread. There's no case of it where they found it spreading from a patient after 9 days. Is that the reason?
So they're having trouble replicating it or growing it after day 9. So they're extending it to day 10. Now, you have to fulfill 2 criteria with the non-test-based strategy. So it has to be 10 days from when your symptoms first started and 3 days without fever-reducing medications, and your symptoms of cough and shortness of breath have to show improvement.
You know, as we get, I'm sorry, go ahead, excuse me.
So all of those criteria have to be filled.
Gotcha. As we get back to normal here, you know, I think the people are itching to get out. It's natural that people want to do so. Companies, I think, the larger a corporation, the more it tends to be following these guidelines. You know, you saw some Cinco de Mayo celebrations yesterday around the country that had people kind of close together. What should people know as they're allowed to do more about how they should respond?
I think to not let your guard down is going to be important, because I think as things reopen, they'll start seeing people not wearing masks, not following guidelines, not being careful, and then they might try to follow that. Well, they're not doing it, so I shouldn't. I think it's really, really important to continue the social distancing to prevent a resurgence.
You know, but that's hard. Let's face it. You know,
it is.
You get out, you're itching to see family and friends. People like their freedom. We're the land of the free.
It is. And you know, I think that it's going to take a while for us to find this new baseline, this new norm. But we've got to try to keep plugging away at it, 30 days to make a habit. And just remember that we're doing this for all of us.
All right. Good message, Dr. Meredith Maxwell. Thanks. We appreciate your time, as always, and stay safe out there.
Thank you. You too.